Hello, everyone. Welcome in. Thank you for joining us today. My name is Kiana Hatfield, and I am the program director here at PAC. And today we'll be talking about speech therapy and ways to live well with Parkinson's disease. Sorry about that. And so today we have Kara Simon-Kuhn here to talk to us about speech therapy and more specifically an option that Atrium Health is offering as a new alternative within speech therapy. And so I will go ahead and turn it over to her in just a moment here. We will be using the chat box function throughout today's session. So if you have any questions, feel free to put it in the chat box and we will answer those as soon as possible. But I hope you enjoyed today's session, and Kara, you have the floor.
Thank you so much, Kiana. Like she said, my name is Kara Simon-Kuhn. I'm a speech therapist and I work for Atrium Health and have for about the last 2.5 years, just been in the Charlotte, North Carolina area for that long. I'm working towards kind of specializing in Parkinson's as well as other neurological conditions in particular, but I have a wide array of interests and I'm excited to be chatting with you all today. Thank you to Kiana for inviting me, and to all of you for taking some time out of your day to listen to me. So let's go ahead and get started. You'll see that I have a disclaimer here that this presentation will include a couple of participation portions. So all you'll really need is just a cup of water or a little drink of your choice if you have that available. Otherwise, you're just going to be swallowing some of your spit, and that's okay too. A couple of disclosures here. So I'm going to be talking about several of the evidence-based speech therapy options available to people with Parkinson's disease. I am trained in the Lee Silverman Voice Therapy Treatment, LSVT Loud, as well as Speak Out, which is from the Parkinson's Voice Project. I don't have any ownership stake in those courses. I'm just a speech therapist who's taken their courses and maintains those certifications. I've also completed graduate research involving the SpeechVive device at Purdue University. I don't have any ownership stakes or stocks in that company either. It's just another option for us. I do work for Atrium Health, although today I'm kind of presenting of my own accord. My views and opinions are representing myself and not those of Atrium Health or Carolina's Rehabilitation. The last one here, and I think this is kind of important, is that I'm happy to answer any general questions you may have about Parkinson's and speech therapy, but also remember for your own privacy and compliance that way that the presentation's being recorded. So if you have very, very specific questions about some certain conditions or symptoms that you yourself may be experiencing, maybe think twice before asking on this platform. We'll definitely talk about referrals and when would be appropriate to ask for a referral by the end. Okay. All right, so the goals of the presentation today, we're going to talk about who a speech therapist is, what that actually means and how they're qualified, what sort of training we receive, what changes happen to your body when you have Parkinson's disease that may warrant some help from a speech therapist as well, and what treatments exist to help you with your Parkinson's disease and to help you with your care partners understanding what you're going through as well, and of course, how to get started. So speech therapy, who and why? Speech Language Pathologists, or SLPs for short, we're trained to evaluate, diagnose, and treat a wide array of difficulties. I always joke that, my name badge doesn't at all say all the things that I do. As speech therapists, we work on speech, which is how you form your sounds, how you move your lips and your tongue and your jaw. We more commonly refer to that as articulation. A good classic example would be the child who can't say their R, right? We work on that. But if you're having trouble due to Parkinson's disease with moving your mouth adequately or having some of that freezing in your face too, that's something we work on. A big one for Parkinson's, arguably the biggest one, is the voice and resonance disorder. So hoarseness or a rough quality to your voice can also involve your breathing or your respiration. Nasality, if air is coming out of your nose or if you sound like you're stuffy, like you have a cold all the time. And also how loudly you speak. I really should have bolded that because I'm guessing that a lot of you have experienced that. Can you repeat yourself? I can't hear you phenomenon with Parkinson's. Also cognition or thinking skills. So that involves your memory, your attention, your multitasking, problem solving, managing your calendar, organizing your own pills, or remembering to take those Parkinson's medications at the appropriate times as well. We can help with that. And also swallowing. So if coughing and choking during your meals, food feeling like it's getting stuck in your throat or having a hard time chewing, that's something else we can help with. So we're going to touch on these in regards to Parkinson's disease throughout today's presentation. Okay. Need to reshare. Okay. So in terms of the training that we receive to provide you with all that good help, speech therapists, we have training and certifications such as a master's degree. We also complete several different clinical internships and rotations. I actually have a student with me right now in the clinic, and she's off working on documentation right now. And we also, most of us, it is not required, but most of us hold the American Speech Language Hearing Association certification. So if on our name badge or in our signature, you see CCC-SLP, that means that we're maintaining a certain standard of education through our certifying organization. And then we also always have a state license. So as with any medical provider, we're not allowed to practice without maintaining a state license. So I'm certified in North Carolina, for example. So as an overview, from here on out, we're going to jump right into our three main topics where we can be of help to individuals with Parkinson's disease. With PD, you can experience difficulty with any one of our three major domains. So the speech, voice, swallowing, or the thinking skills or cognitive skills. The most common being speech or voice, but swallowing and thinking right behind. However, I do want to note the big elephant in the room, which is why does this all happen too, right? You might think this is a less known symptom of Parkinson's to have these kinds of difficulties. Everyone knows tremor, balance, gait. So the answer is the same as with those other difficulties. It's dopamine. So it's a type of neurotransmitter and hormone that's in the brain. It's specifically in the substantia nigra and in the center of your brain in simple terms. So it's a chemical messenger. It communicates messages between nerve cells in your brain and the rest of your body, and it controls your movement, right? And so everyone thinks of the big muscle groups, your core, your legs, your arms, but also the muscles of your face, your throat, and your breathing. It helps with memory. It helps with motivation and feeling like pleasurable reward for completing a task, as well as your attention skills and your mood. So that's why when you see one patient with Parkinson's, they may look very different than the patient sitting on their right? So everybody looks a little different, but I always tell my patients, if you're having difficulty, just blame it on the dopamine. Always blame it on the dopamine. And I don't tell you all of that to scare you, but to help you understand the underlying reasons why you may feel the way you do, right? The good news is we can help with any of those. So we're going to go through speech and voice exercise to make your voice louder or an external aid, swallowing exercises, as well as thinking strategies. So starting with speech therapy and Parkinson's speech and voice, about 75% of people, so most people with Parkinson's, experience changes to their speech and voice at some time. You may notice a voice that's quieter, sounds softer, especially when you're out in public. People might not be able to hear you. Hoarseness or a rough quality to your voice. So that might be that you're talking kind of like this, or even your pitch can kind of go higher because you're straining your voice to kind of compensate for decreased breath support. Some people start speaking in short rushes of speech. So they start speaking more quickly and then they slow down, and then they start speaking more quickly and then they slow down, which makes it harder to understand as well. A lot of my patients really struggle to get deep breaths when they're speaking. They feel constantly short of breath or like they're breathing shallowly, and that's because your breathing is controlled by the same core muscles that control your balance. And some patients, it's a much smaller group, but also will experience stuttering or difficulty forming words. They might kind of start blocking on a word, like saying, my name is Kara. And it's important to note that these changes come on gradually, right? So you won't wake up one morning and suddenly have a softer voice. It happens over time. In fact, it might not even be the person with Parkinson's disease who notices this change right away. It may be those around them, which brings me to my favorite piece of education I love to give in my office for my friends with Parkinson's. And that's the impact of dopamine on your perception of your own speech loudness. Okay, so most people with Parkinson's disease actually feel like they're speaking at an appropriate loud volume, even if they're not. So they actually genuinely think that their partner might have a hearing problem because they feel like they're shouting to be heard at times. And that's, again, because of dopamine. Blame it on the dopamine. So a big message I like to give people in the family and support system is know that when your loved one is asked to bring their voice to a normal loudness, they feel like they're shouting. They're not being difficult. It's not their fault. It's the dopamine, right? So part of what we aim to do in speech therapy is recalibrate what sounds and feels normal for your loudness, if that makes sense. So I love this breakdown of communication comic. It just makes me laugh because, communication's a two-way street. It seems like some people aren't talking loud enough, aren't paying attention. The environment's not set up well because this gentleman's watching the TV and maybe he's not speaking loud enough, but she also can't hear. So makes things challenging. So some of these more traditional evidence-based speech and voice therapy options, the big one that you probably have heard of is the LSVT Loud. If you haven't heard of LSVT Loud, you've certainly heard of LSVT Big, which is kind of the physical therapy counterpart. And the other one is Speak Out, which comes from the Parkinson Voice Project. So these are, I would call them clinic-heavy treatment options, right? So you do, as a speech therapist, 10 or more hours of continuing education, and then you pass a certification exam. And then in order to maintain that, you do little quizzes and kind of certifications throughout the rest of your career, as long as you want to maintain your certification. So for patients, this means that you come to the clinic anywhere between 2 and 4 days per week. So for LSVT Loud, they require 4 days per week, 4 weeks, so 16 sessions. And if it's less than that, it is not called LSVT anymore. It's required to be that frequent. And then Speak Out is like a little more flexible. It's 2 to 3 days per week across maybe 6 weeks, and then a gap, and then like another checkup, basically. So for these programs, they're pretty similar in the style of exercise, and they both have the goal to improve your internal cueing. So we're trying to recalibrate your speech to give you more speech, louder speech. It feels different, but we want you to feel this is the normal, right? And so the cues differ slightly between the programs. LSVT really likes to emphasize loud. They'll say, oh, you're not loud enough. Loud, loud, loud. That's the main cue. And for Speak Out, they really like modeling. So saying, say it like I do. And they also tell you, say it with intent. Say it with confidence, like you're the CEO of a company. Okay, so main thing to know about these programs is your speech therapist certified in one of these programs if you're pursuing speech therapy, because you want them to be. And know that you have to dedicate the time to make the change too, right? So when you see your speech therapist in the clinic, they'll be asking you, did you do your homework? And we can tell if you've done your homework because it is exercise, right? So you're expected to commit about 15 minutes or 20 minutes 2 times a day to help maintain that exercise, right? So bearing that in mind, let's practice. So you don't have to unmute to do this. I mean, people in my office are used to hearing strange noises coming from my office, so it's fine. But we are going to try out a couple of different exercises you might encounter from LSVT or Speak Out, okay? So the first step is always to set up your environment for success. So I'm a sloucher, don't slouch, sit up nice and straight for me, okay? And put both feet flat on the floor if you can. And what we're gonna do is try these syllables here, but we're not gonna say them normal, we're gonna say them with intent. So it'll sound like this. May, me, mo, okay? So that was your example. So everyone, hopefully still sitting up nice and straight, get ready to try with me. Ready? May, me, my, mo. Ooh. Ooh. You may have run out of air a little bit. That's okay. It gets easier with time. You normally do this about 5 times. It's your first warm-up activity and speak out. Let's do one more, okay? May, me, my, mo. All right. Next, this one is very similar between speak out and LSVT. Couple little differences, but we're not going to scream. We're going to hold out a nice, beautiful, long ah. Lots of intent, very loud. So it'll sound like this. Ah. And you'll hold it out. Important consideration is we're not singing here. So we're not, no. I want it to be at your normal talking pitch. So this is not going to sound like singing a chorus with your speech therapist necessarily. We're not harmonizing, nothing like that. Your talking pitch is where I want you to be, okay? So one more time at a nice comfortable pitch. Ah. All right. So you can hold that out for speak out for up to 10 seconds. LSVT has you do it a little longer. So your speech therapist would be happy to guide you through that exercise as well. All right. I'm not going to put you guys through the pitch glide portion. All of my patients say it's the hardest part, but that's when you kind of glide up. And have to hold it. So I demonstrated it for you. We're not going to do it today, but that is a piece of this. The next exercise is counting. So what you will do with this is not counting 1, 2, 3. No, lots of intent, really drawn out like this. 1, 2, 3. All right, so everyone join me with 4. Ready? 4, 5, 6. Keep up your intent. 7, 10, 11, 12. Okay. Now the Speak Out workbook kind of varies this a little bit so that it's not the same every day. So sometimes it adds more numbers, lengthens the phrase, makes it a little harder. As you get stronger, we want to challenge you more. Sometimes it's counting by 5s, counting by 10s, also helps with your cognitive function too, right? These programs do also include cognitive portions. So we might have you do little naming tasks like tell me as many fruits and vegetables as you can, but keep up your intent during it. Because again, we're recalibrating. We're recalibrating when you're speaking to people. If you're interested in those particular programs, you can search for a certified provider on their website. So I did provide those here. Like I said, Speak Out comes from the Parkinson Voice Project in Texas. And LSVT Loud, of course, comes from LSVT. So I forget where they are. They're kind of spread all over the country and the world at this point, so it's hard to say. One more option we have here. So should the, you do the exercise programs and you find, okay, this isn't working for me like I thought, I feel overwhelmed. If you're not responding to it the way we would like, which most people do, to be honest, if you have the time to dedicate and you can do it. Or if you don't have the money, you're thinking, I can't come to the clinic 4 days a week. I can't come 2 or 3 days a week. That sounds like I can't do because I don't have transportation, or I don't want to, burden my care partner on having to drive me there. They're working too. We do have a device option. So this is something that's relatively new. Medicare just started reimbursing for this 80% as of October. And some of the kind of Medicare replacement plans, such as Humana, just started reimbursing 80% as of April 1st. So we're talking about very, very new cutting edge stuff. The Speech 5 is a wearable aid that goes behind your ear that's available as an adjunct or alternative therapy for those traditional approaches. So you can still do Speak Out therapy, and maybe we want to set you up with a device as well. The way Speech 5 works in general is that it plays a noise in the person's ear to provide an external cue to speak louder, slower, and more clearly. And that takes advantage of a natural cue called the Lombard effect. I always kind of lovingly refer to it as the Cracker Barrel effect. If you think about how you speak when you're just talking to someone at the dinner table compared to how you speak when you're at a Cracker Barrel or a noisy restaurant, you might hear dishes rattling in the back. There are people around the fires crackling, footsteps, speech all around you. You speak differently, and you speak differently naturally without having to think about it. So what I'm going to do is walk you through this that I took from the Speech 5 website. So the way that it works is you come in for an evaluation, and if this is something you're interested in and you're a good candidate, the speech therapist can run a calibration. That calibration tunes the device to your voice so that when you speak, and only when you speak, the Speech 5 plays a babble sound in your ear. They call it a multi-talker babble. Sounds kind of like the Charlie Brown voice, like wah, 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 wah in your ear. And that cue causes you to speak over it naturally. So it's a reflex. You speak louder as the sound around you increases. You speak 50 to 75% louder than your typical speaking volume if we have it calibrated appropriately. When you're not speaking, it's quiet and you can listen and then participate in the conversation when you're ready. So like I said, I do like to use this kind of as an adjunct. It might be that I still say, okay, I'm having to have that device really sensitive to work for you. I want you to do these exercises. Let's work on that together. But let's go ahead and see what your insurance will cover with the device to help you maintain those gains and keep your progress going. Or if it's the only option available, it's what you want, you don't want to do the exercises, or you live in community living and you're going, I can't do them, then great, let's do the device, let's give it a try. Like I told you, insurance coverage, Medicare is providing 80% reimbursement, and the Veterans Administration actually is providing 100% reimbursement when you're working with an eligible provider. So a lot of the VAs in major cities are already providing this. I don't believe the VA close to Charlotte is, but I've certainly worked with some people on their veteran insurance and provided it through Atrium. Self-pay options are available. So it's approximately $2,500, woo, steep, but that's without the 80% reimbursement. And they also do it on a payment plan. So you can kind of pay month to month. If you have questions about Speech 5, I recommend you visit their website. They have a very nice patient portal there. If you're interested in a device, talk with your doctor, your neurologist, your primary care doctor, whoever. If you think you might be a candidate, they can send in a referral for speech therapy for you. They can also send a referral directly to the company. And if that's the case, the device can be calibrated remotely, or you can see a Speech 5 speech therapy provider in your area for evaluation and calibration of the device. Okay. I'm offering this device at our Huntersville Clinic with Carolina's Rehabilitation, and my colleague at the University City Adults location is also offering it, so kind of on the northeast side of the city. So we're happy to see if you're interested in that as well. So I've done plenty of talking right now. That's all I've got for the speech and voice portion of today's presentation, and we will also move on to swallowing and cognition. Did anyone have questions about these options or changes to speech and voice due to Parkinson's disease?
Hi, Kara.
Yes, I can hear you.
Hi, fellow Boilermaker.
Oh, yay, boiler up.
Boiler up. At the beginning, did I hear you say that the muscles of the breathing muscles also control balance, the breathing and the balance? What did you say about that?
So, I mean, I could go on all day about respiration for breathing, but when we speak, it's actually kind of physics. So if your container is big, then the pressure goes down,
right,
and the air rushes out. If the container is small, then the pressure goes up and the air rushes into your lungs. So it's container change. And what controls that container change is your diaphragm muscle,
right,
and also your expiratory muscles, which are kind of your core muscles here around your abdomen. So those expiratory muscles what they do is they control the descent of your rib cage. So where your typical breathing looks kind of like this, in, out, in, out, in, out. When you breathe for speech, you breathe in, it comes out a little bit, but then we use our breathe out muscles and hold that rib cage in place so we can talk out longer. And so that's what becomes really challenging in people with Parkinson's disease. They really pause more frequently, breathe more frequently because of that problem. And we do have, I neglected to put in the presentation, but there's an expiratory muscle strength trainer that I also frequently use with my Parkinson's patients to help with that particular issue.
Okay, thank you.
Yeah, of course. Good question. I think there might be something in the chat.
I have a comment. So Kara, you've helped me a lot with my situation, and what I found out was, and I've used both the breathing device that she's talking about, and I went through the Speak Out program, and I saw a remarked improvement in my voice. And I went through the whole program, but then I didn't continue it. And I noticed I fell back into talking softly and having a raspy voice again. So I'm starting to go back and use that. So that's the thing I've learned, is you really have to keep up when you have Parkinson's, which is relatively new to me. The last few months has been when my symptoms have started really getting worse, but it's really keeping up with both PT. I went through some physical therapy to work on the rib cage, and that all helped. So I saw a remarked improvement, but you have to keep doing it. You can't just turn it off and expect you to stay where you're at. Just an observation and comment.
Yeah, that's absolutely true. And that's one of the reasons they developed SpeechVive a little bit, is because if people don't have adequate caregiver support, or they're not able to maintain that for whatever reason, it is very challenging. You're absolutely right. Both LSVT and Speak Out recommend that once you're established with a trusted speech therapy provider, you should come in for tune-ups. So if you feel like, am I doing the exercises wrong? If you need more help and you want to come in, every 6 months, every year for a tune-up, that's absolutely indicated. Parkinson's is unfortunately a degenerative condition. So we expect you to kind of need help across the continuum of progression. I see from the chat that someone had an excellent question here, Ellen. She said, what if the person wears a hearing aid? And it's funny because I just answered this question on the phone from someone who's a prospective patient this morning. So I said it earlier, I'll say it again, communication's a two-way street, right? So if you wear hearing aids, if you're profoundly hearing impaired, this might not be the best option for you. If you have mild hearing loss and you wear hearing aids, you can still wear one hearing aid in one ear, probably your better ear, I would say, but we can talk with the company about that if you see me or another provider. You can wear a hearing aid in one ear and the SpeechVive in the other. So, you can change it out depending on your communication situation. If you're going to the movies, you probably want both hearing aids. If you're going to a concert, you want both hearing aids. If you're going to a family party, you might want one ear SpeechVive, one ear hearing aid, if that makes sense. And the device does come in both a left ear and a right ear. My clinic one happens to be a left ear. So this is what it looks like here. You can see it. Looks kind of like a Bluetooth headphone. One of our staff members here, I had a patient walking around with it on, and they said, he looks like a secret spy. He loved that. He thought he looked pretty cool. All right, I hope I answered that question. Good comments from everybody. Any other questions? Right, I'm not good with dead silence. It's something I'm working on, but we could always come back to it at the end if we need to. Okay, so I'm going to keep moving on to swallowing. All right, so speech therapy and Parkinson's, swallowing. More than 1/3 of people with Parkinson's disease may experience changes to their swallowing. That's something that's really novel for a lot of people. One, they don't know that your swallowing can be a problem unless they know someone who had this issue. Or two, they also may not realize that it changes in Parkinson's or what the symptoms even look like, right? So what it may look like is difficulty with chewing your food, right? So you might kind of have to be chewing longer than you want to, some jaw pain with that or something like that. Food left over in your mouth after you swallow and you're going, why am I having it pocketing over here, or it's coming in the front of my lips, things like that. You may have a feeling of leftovers stuck in your throat after you swallow. So you're swallowing and swallowing. I have to swallow 3 or 4 times where I used to only swallow once for that bite of food. The big one is coughing and choking during meals. So everyone knows that feeling of food or liquid went down the wrong pipe. And it feels awful and horrible. The even more scary secret is that some people have food or liquid going down the wrong pipe and they don't feel it at all. So sensation can be impacted, especially by things like a stroke. So it's something that we look for as a major symptom, but it's not always there. A lot of my patients with Parkinson's really have a hard time with saliva. It's both sides of the coin. Some people say my dry mouth is absolutely terrible. It's horrible at night. And then half the people say, okay, I have way too much saliva and it's not able to manage. I have extra saliva. And the other thing that I've been reading a lot more about recently, because I noticed a trend across my patients, is the reflux and heartburn piece. So when food or liquid's kind of coming up your esophagus into your vocal cord area and you feel that burning, it seems, I read an article recently, and it was only one article, so I'm sure there's a better statistic, but the one I read said 4 times more likely for reflux in people with Parkinson's disease. And again, these changes come on gradually. You won't wake up one morning and be coughing and choking during your meals. It might be more like 1 time a meal, and then suddenly it's 2 times a meal, and then it's kind of worsening over time, if this is you, 1/3 of people, right? So, speech therapists, we are specialists in the mouth, throat region, all of that. So this kind of fell to us more like in the 1980s, I believe, around there. The kind of pioneer for this was, her name is Jerry Logeman, and I have her textbook on my desk always because she's kind of the guru of all things swallowing in our world. But what we do is we evaluate your swallowing in the clinic, and we might give you kind of a selection of foods. We'll check the muscles of your head and neck and see how things are functioning and what we can do to help. If we feel like in the clinic that we need more evaluation, we might refer for an X-ray swallow test. And that's what my image here is of. This is what's called either these are big fancy words, you do not need to write it down if you're taking notes, but a video fluoroscopic swallow study or a modified barium swallow study. So those are the 2 for the X-ray, or we might refer you for kind of an endoscopic exam or what's called a FEES. So what we're looking for then is confirming if aspiration or food or liquid going down the wrong pipe is actually happening. Okay, so people cough during meals for a variety of reasons. Just because you're showing that during meals does not mean we're aspirating. We cannot detect that without these X-ray tests. Okay, so your friendly neighborhood speech therapist would, I'm sure, be happy to chat with you, do a bedside kind of examination, let you try some consistencies of different things, and based on your symptoms, determine if that further testing is necessary, okay? Part of that testing is to help figure out which strategies will help keep you safe. So we might have you tuck your chin. Don't do that if you haven't been recommended. It can make swallowing worse for some people, better for others. So you could tuck your chin. We might have you turn your head to the side. We'll test all that out in the clinic and see what works best. And we'll also teach you exercises to improve as well as maintain your swallow strength and safety. There's also some interesting evidence that the Speak Out and LSVT programs really and truly help with your swallowing as well. So that's pretty cool. That's newer evidence. So all that being said, it's time for another practice. This one will be less loud. Hopefully no one came running when you were doing your ahs. I'm going to teach you a catch-all exercise here. It really targets a lot of the muscles involved in swallowing. One of my mentors used to say that the best treatment for swallowing is swallowing itself. And that's kind of where this exercise is born. So we're going to learn a hard swallow. So if you don't have water or a drink with you, that's okay. You can swallow your spit, but you'll probably run out of it a little faster. So what you're going to do is take a sip of your water into your mouth or gather that saliva up. And then I want you to push your tongue to the roof of the mouth as hard as you can and squeeze and swallow as hard as you can. Everyone has had that moment where like a piece of steak or a pill feels like it's stuck in your throat, you're going to swallow like that's there, but it's not. Okay, so it's a swallow specific exercise, practicing a hard swallow. So a normal swallow for me would look like this. Basic. You might have seen my throat move just a smidge, probably not. This is me doing an effortful swallow. Really, it should be effort. Sometimes I can hear the patient swallowing when they do an effortful swallow. This is kind of twofold. So not only is it an exercise strengthening the muscles, it's also a strategy, right? So we kind of have two fields within swallowing. We might teach you strategies to keep you safe, like a different posture, like a chin tuck, or we might do exercises, or we might do both. This one falls into both categories. So I think it's a great one. It's a really nice way to keep your swallow healthy and strong. So you could, does every bite need to be like this? No, but you could make a deal with yourself or your care partner. We're going to do 10 hard swallows for the first 10 bites of our meal tonight and every night, helps keep you strong. It certainly won't hurt anything. So that's it for the swallowing portion. Do we have any questions about Parkinson's disease, swallowing changes, speech therapist, and swallowing, anything like that? Pulled up the chat just in case anyone's typing. I'll give you a minute to think about it while I rehydrate. All right. Well, if you have questions later, happy to answer them. So we'll move on to cognition. How are we doing on time? Oh, we're doing well. Okay. So Parkinson's, cognition. If your neurologist hasn't talked with you about it yet, not everyone with Parkinson's will have a cognitive difficulty, and not everyone with Parkinson's has what we call a dementia along with it, right? So 50% of people with Parkinson's on average experience changes to their thinking skills. You may notice changes to your memory. If they're really significant, if you're not remembering lots of things that recently happened to you, or even remote events like how you met your partner or something like that, that you really want to talk to your neurologist about. But even just kind of a mild problem, if you're going, I used to know these people's birthdays and I just can't keep track of it anymore. It's something to talk to a speech therapist or your doctor about. You may have difficulty with planning or problem solving. So maybe you used to manage the bills for your household. It's getting harder to manage. Maybe you used to sort your own medicines in the pill sorter. That's harder, right? Some people feel just more easily distracted. Some people have ADHD to begin with, and maybe now it's getting worse. You just feel disorganized, like your brain's wandering all different directions. Difficulties with multitasking. There's really nice research out there that shows that multitasking is when falls happen the most, actually. We kind of think there are competing cognitive resources there. And there's some good evidence that we can do good therapy with task-specific multitasking in the clinic to help you out with that. So if you're having a hard time having a conversation while folding laundry, we might practice having a conversation while folding laundry, right? You practice that task to get better at it. And we teach you strategies to do that as well. The hardest part for me is the changes to motivation too, right? You might know you have these problems. You might know you need to exercise, but gosh, you don't feel like doing it, more so than before. Again, blame it on the dopamine, but rely on your care partners to help you stay on track and, put your best foot forward on all your cognitive tasks, swallowing, speech, what have you. Some of my patients also feel like they're losing their train of thought when speaking more frequently. So we can certainly borrow some therapy, maybe even from the aphasia literature if it's getting really difficult. Aphasia being a change to your language skills, most commonly happens after a stroke, but can happen with a variety of conditions. So people who are having a hard time coming up with the words they want to say, we might work on that as well. Again, I'm a broken record, but I want you to know that changes come on slowly. They impact patients differently. If you're having a cognitive change that seems really acute or like it's happening all of the sudden very rapidly, oh, please talk to your doctor. That should not be happening. Okay, it should be gradual. And if you reach a tipping point, you go, I need some extra help, we're here for you, right? I kind of alluded to this already, but research has really shown that with cognitive treatment, the most functional things that are giving you difficulty are the best to work on. I tell my patients, you know, if you want to run a marathon, you practice running, you don't practice swimming, right? So some examples of things I've worked on with patients on my current caseload. We might help you figure out a better system for keeping track of your appointments. We may help you to sequence or put steps in order for your favorite signature recipe, because maybe you're having a hard time managing that. Or we might help you practice describing pictures or something because you're not having trouble thinking of the name of your favorite restaurant. But if you learn to describe, okay, it's an Italian restaurant, I always order the bolognese. This is a real example. That helps you come up with the word, right? So the sky is really the limit with cognitive therapy. I find that the best indicator that cognitive therapy is going to be successful is a nice motivated patient who's really wanting that help so that they don't, you know, it's a hard thing to admit, I'm having trouble with my thinking skills. People often feel really overwhelmed by that. So if you're open to the help with it is number one. And number two is having a supportive care partner who can help you make those changes at home. You know, for example, we might help you set up your environment, label the contents of drawers, things like that. It's really strategies based. Okay, so any questions about cognitive treatment? That one was a little more brief, but we don't do quite as much of that with Parkinson's. Other populations, yes. I'm going to count to 10. If there are no more questions, then I will go to my wrap-up portion, okay? Right. 10 Mississippi, I'm going to move the slide. How do I get started, right? So maybe you're listening to me talk and this isn't you yet. That's great. I'm happy for you. Wonderful. You don't need us right now. Just know that we're here for you if you do need us. If you do resonate with some of the things that I'm saying today, try talking with your neurologist, your primary care provider, or if you are fortunate enough to have a movement disorder specialist. If you're, maybe your care partner is listening today and they think, I think I'm noticing it as well, as we talked about with speech and voice, and maybe the care partners who notice first. Talk with the doctor, ask for a speech therapy referral, see if they think you'd benefit. I always say getting into the clinic, you can't do it too soon, right? Even if you've just been diagnosed, it's great to establish with someone that you trust so that you can have that progression of care throughout your disease course, right? Use resources in your area. Obviously, I'm preaching to the choir here because you're all on a Parkinson's Association of the Carolinas call, but there's also the Parkinson's Foundation. Use those resources to find support groups. You're not alone in this. A lot of my patients, sometimes by the time they get to me, they think they are. They really don't know anyone else with Parkinson's, but oh my goodness, it is on the rise. So you're not alone in this. We can get you hooked up with different support groups, friends in the area, different things like that. And then you meet more people and maybe they'll let you know if there's a provider who they think might be able to help you out. As for that referral, if needed, we already said that. You can also contact the local clinic directly and ask them, is a referral required? Different clinics may not actually require a referral, but it shouldn't be too difficult to get one from your neurologist either, in theory, hopefully not. Talk to your insurance company each year. I always say this goes for PT, OT, or speech. Ask when you're looking and shopping around different policies, private insurance, Medicare, whatever it is, how many visits of therapy are covered? Is it, some policies will say, okay, 60 visits per year, but we have to divide it PT, OT, and speech therapy. Or do you get a dedicated pool, or is there no cap to the visits? Ask that question, see what they say. Maybe your speech therapy wouldn't be covered very well this year, or you've already used all your visits with physical therapy. And in that case, maybe look for a policy for next year that would cover more therapy if you think you're going to need those services. Okay. There's something in the chat. Let's see. Is Huntersville the only place to get SpeechVive? Good question. If you're in the Charlotte, North Carolina area, the only 2 clinics I know of that are offering this right now for sure are me in Huntersville. And then I also secured a device for my colleague, Deja Bryson, who is at the University City Adults location. So we both have an in-house trial clinic device, and we'd be happy to help you get fitted for one, try one out. The number of visits required for SpeechVive is significantly less than doing one of the exercise programs. So what it would require is an initial evaluation. We always do a comprehensive evaluation. And then if you decide that's the only option you want to pursue at this time and do the SpeechVive, we'll work with your neurologist or your referring physician. We'll talk with the company, get the insurance. It can take, you know, a month, 6 weeks, something like that. It kind of depends on your insurance with these things. But they will get that funded and send it to your house. And then once it's at your house, you can bring it back in, have another follow-up session with us in the clinic. So 2 visits, and we'll calibrate it for you and get it set to your specific specifications. And then we might do a 3rd one also, you know, a month or 6 weeks out, just to make sure that those settings are what you want. Okay. And then you can follow up as needed with new referrals. Ellen said, is there anything in South Carolina? I am not positive. Likely, yes. I'm sure someone is doing it. I'm just not aware of it. But like I said, you can reach out to the company directly and they'd be happy to help you as well. So there are referral forms on their website and things like that. So if you talk with your South Carolina neurologist and give them that paperwork, they send in what's called a DME to the company, which is basically a medical equipment order. And the company can work with you from there. They're very helpful. If you talk to Michelle, say hi. Yes, thank you. I see Kiana has put the link there again. All right. Referrals information. So we were talking about me. So where can you find me? Referrals information as follows. I'm at the Huntersville location, and the phone number and fax number there are for scheduling evaluations. So our number here in Huntersville for our direct office is 704-801-3719. I guess I'll put that in the chat, and you'll get one of our front office staff though. But they can send me a Teams message and let me know that someone called. So that's the Carolinas Rehabilitation Huntersville office number. But if you're looking for an evaluation with me, have them fax it or put it in Epic for Carolinas Rehabilitation. So centralized scheduling fax number is listed there. I'm also very reachable by email. I can't let emails sit too long. It makes me a little crazy. So always feel free to email me. I'd be happy to help if I can, or hopefully I can get you connected with someone who can help you. Okay. Thank you. I really appreciate you guys taking the time. I love sharing all of my skills and knowledge that I've been working to accrue in this patient population. I always say my Parkinson's patients are my favorite because they know that what they're talking about, right? I have so many patients who do the research, do the homework, they're strong advocates for themselves. And I know that if you're on this call, I'm sure you are one of them. So I believe this recording will be available later. I'm sure Kiana's going to let us know about that. So if you have friends who you think would benefit from this information, please feel free to share that link. If you have other questions, I'm still here, so let me know.
Thank you very much.
Thank
Bye.
you. I appreciate it.
Yep, thank you.
Thanks, Ken.
Thank you all for joining us today. And if you have any other questions, feel free to ask Kara here while she's still on the call. I'll just give you a moment if you have any questions.
Thank you, Mary Kane. Let's see, I can give this a little thumbs up. There we go. Thank you. I know that feeling of not wanting to unmute your microphone on a Zoom call. So we've all been there.
And it looks like Terry here gave you a thumbs up as well.
Great.
She did hers over camera, so thank you for that.
Awesome. Thank you so much, Terry.
All right, well, if there are no other questions, this recording will be available online on YouTube later this week. So if you have any questions in the meantime, feel free to reach out to me. Kara also provided her contact information, so hopefully you all had a chance to note that as well. But if not, feel free to just reach out to me and I can connect you as well. Thank you, Kara, for this amazing presentation. And thank you all again for joining us today. I hope you enjoy the rest of your afternoon.
Thanks so much.